border for that, or the separation between that and the next muscle, caudally. Just finish getting this done. Okay, so one thing I want you to do at first is separate between the Sartorius and the next muscle, which will be the Tensor fasciae latae. And as we follow that separation medially, you should be able to pull it away from the medial thigh as a thin sheet right here. It's going to go all the way to about where these blood vessels are running down the medial surface. And you'll see the Sartorius going out onto the medial surface of the knee and medial tibia, proximal tibia, and it originates from the ilium. So one of the things I want you guys to see as you're doing these dissections and to think about is, you know, where on the pelvic girdle are these originating? Where on the femur or tibia, whatever, are they inserting? To start thinking about the action, the line of action of those muscles and in relation to the joints. And with the Sartorius, it's an really interesting muscle because it originates from the ilium up here. It crosses the hip joint and acts as a flexor at the hip joint. And it crosses the knee and acts somewhat as a flexor of the knee, depending on the orientation of the tibia or whether the knee is extended or flexed. And because it's going from lateral to medial, when it contracts, it produces a lateral rotation of the femur. And so it's called the Sartorius because a Sartor was a tailor. And tailors would sit on the ground cross-legged and lay their clothing, the textiles, over their lap and do their cutting and sewing on their lap. And so when you sit cross-legged, you are performing the actions of the Sartorius muscle. Flex the knee, or flex the hip, flex the knee, and laterally rotate the femur. And what I want you to do is bisect the Sartorius. Oops. Once we've seen the borders of it, and then you can follow that border and reflect the Sartorius distally down toward the knee and then proximally up toward the hip, and just kind of keep that out of the way. The next muscle right next to the Sartorius, caudal to the Sartorius, on the lateral surface, is a complicated muscle because it is triangular in shape and also kind of triangular in cross section. And it inserts onto a large fascia over the quadriceps and thigh, lateral thigh. And this is the fascia latae, this fascia. And that muscle is the tensor fascia latae, similar to the tensor fascia anabrachii that we saw on the medial surface of the arm, the brachium. Tensor fascia latae is kind of a triangular or V-shaped muscle right here on the surface of the hip that inserts down into that fascia. And it usually, depending on your specimen, but it usually kind of blends into or runs up right against another superficial muscle that also inserts into that fascia, and that's the gluteus superficialis. Gluteus superficialis in these cats, particularly these little ones, is going to be a real thin sheet of muscle. And you can see that muscle right here. This thin sheet right here is gluteus superficialis. And I'll illustrate the tensor fasciae latae in a little more detail here as we kind of cut that out, dissect it. Now, both of those insert into the fasciae latae, and they're similar to the arrangement in humans. We have a tensor fasciae latae that inserts into a fibrous connective tissue sheet that runs down the lateral surface of our thigh called the iliotibial tract, or the IT band, people sometimes call it. It's a thick connective tissue tendon that runs down the side of your thigh, and it has the tensor fasciae latae inserting into it from the ilium, and the gluteus maximus inserting into it from back by the ischium. And the gluteus maximus, our gluteus maximus, is equivalent to the gluteus superficialis that we see in the cat. In the cat, it's much smaller. In us, it's the largest of the gluteal muscles, and that's because we keep the gluteus maximus or superficialis partially will extend the hip joint, pull the thigh back. And in us, we use that to stand, we use that for jumping, running, etc. You know, in the cats, they don't keep their thigh or the femur extended, they keep it in a flexed position. So they don't use, most of the gluteus superficialis is used for abducting the femur. Anyway, we'll talk more about those muscles in lecture. But the gluteus superficialis in the cat is just this thin layer, and if the way you approach that and the tensor fasciae latae kind of depends on your particular specimen and how it looks. And since I've got a tear right here, I'll go ahead and use that and cut through the tensor, or the gluteus superficialis, and we'll come back to that in a little bit. And peel that up from the rest of the gluteal complex, and that will expose the largest of their gluteal muscles, Gluteus Medius. And what I want you to do is to try to approach this complex, sequentially, so that you can put things back together and start over and go from superficial to deep after you've identified everything. And then, 2 days later, come back, everything back together, go back through it and peel them back so that you can identify them. Now, the tensor fasciae latae is a tricky one to try to bisect because of its strange shape and because it sits in little pockets of other muscle. And so it's hard to know if you're cutting the right muscle or cutting too much. But if you can cut through that cranial edge of it, and then it will get thin as we go back towards laterally and caudally towards the gluteus superficialis. And so you can meet up with the cut that you made through the Gluteus Superficialis. And depending on your specimen, you might start on the Tensor fascia latae and just get to the Gluteus Superficialis later, depending on how it looks and which is more available. But then I can peel that Tensor fascia latae away from this Gluteus Medius, which is deep to it. To see the borders of Gluteus Medius. Now, Gluteus Medius is this large chunky muscle here. It forms kind of a triangular shape, and it inserts onto the greater trochanter right here. And so you can see under the Tensor fascia latae, the cranial border of Gluteus Medius, and back here under the Gluteus Superficialis, you can see the caudal border from here to here. And what I'll cover now, the rest that I'll cover now, is just how do we get through that Gluteus Medius down to the other gluteal muscles. And one thing that might be helpful is to go back and bisect and reflect the biceps femoris. And so on the lateral surface of the thigh, I've already identified the cranial border of the biceps femoris, and usually you can see a boundary between a lot of fat and connective tissue back by the hamstrings, the posterior surface of the thigh, and this large triangular muscle that runs from the ischium out onto the fascia over the knee and tibia. This is all biceps femoris, and it's a primary flexor of the knee, or what we call one of the hamstring muscles, and it runs down the leg laterally, and so its caudal border forms the tendon that you feel on the lateral side of your popliteal region, the back of your knee. You can feel that tendon running across the back of your knee. On the lateral side, it's biceps femoris. On the medial side of the popliteus, it's semitendinosus. And in the popliteus or back of the knee forms this pocket. It's always, in these guys, full of a lot of fat and connective tissue. And so if we pick this fat out, we can see another muscle coming from the ischial tuberosity and going medial, and that is the semitendinosus. And so as you pick out all that gunk in the popliteal pocket there, now you can see biceps femoris laterally and semitendinosus medially. And we'll see that again as we look at the medial surface of the thigh. But then I'll use that to separate the biceps femoris from the underlying tissue. And there are a couple things you want to try to watch out for as you're doing that. One, there's a large nerve that runs from the pelvic girdle down the lateral and posterior parts of the thigh, and that's the sciatic nerve, we call it. In here they use the old name, the ischiatic nerve. So ischiatic and sciatic mean the same thing, and you can see that big noticeable nerve. And you might want to look underneath the biceps femoris as you're separating it to pull that away from it so we don't cut it as we bisect it. The other thing is, on the cranial border of the biceps femoris is another muscle that you can't see the border from the surface, but from deep I can see the separation. And that's a muscle that comes from the caudal vertebrae up here, and it was actually cut through right here, and runs down the inner surface of the biceps femoris right on the cranial border, and then inserts into the fascia around the biceps femoris, and that's the caudofemoralis. So this muscle right here is caudofemoralis, and you can see as I pull back this way, the fascia in between